A serious injury today typically means an ambulance ride, an x ray, and a nurse asking you to rate your pain on a scale of 1 to 10, while you privately reconsider every decision that brought you to that moment. 50,000 years ago, there was no ambulance, no antiseptic, no antibiotics, and definitely no suspiciously overpriced hospital sandwich waiting for you. So, a shattered arm, a fractured skull, or a deep wound from a hunt should have amounted to a death sentence. Except prehistoric skeletons keep undermining that exact assumption. Archaeologists keep finding ancient bones that were broken, displaced, sometimes violently damaged, and then healed. Not barely, either. Some individuals survived for years after injuries severe enough to leave them unable to hunt, travel, or defend themselves, which means somebody fed them, somebody protected them, and somebody may have known how to clean a wound, set a bone, ease pain, and hold off infection without ever knowing what bacteria actually were. So, how did ancient humans actually survive serious injuries? The answer begins before medicine, before surgery, and quite possibly before our species even existed, with one remarkable survival tool. Other people. Before anyone could actually treat a broken bone, humans first had to solve a more basic problem: staying alive while temporarily useless. For most animals, a serious injury isn't just painful, it's an eviction notice from the entire food chain. A predator that can't chase goes hungry. Prey that can't run becomes lunch. Even a fairly minor wound can make finding water, regulating body temperature, or escaping danger nearly impossible. Early humans faced those exact same biological rules, but they'd found a loophole: cooperation. Humans and earlier members of our genus lived in social groups where food could be shared, threats confronted collectively, and an injured person didn't have to perform every survival task alone. Someone else could carry water, someone else could bring meat, someone else could keep the fire going while the patient contributed mainly by lying near it and resisting the urge to invent screaming as a formal language. Fire mattered enormously here. It provided warmth to people who could no longer move enough to regulate their own body temperature. It kept predators at a respectful distance. It softened food for anyone with damaged teeth or a weakened body, and it created a relatively stable spot where an injured person could remain while the rest of the group kept gathering resources. Shelter served the same underlying purpose. Recovery takes real time, and time is hard to come by when rain, cold, insects, and large carnivores are all competing to finish what the original accident started. A protected camp turned healing from a desperate biological longshot into something the body actually had a genuine chance to complete. But the real prerequisite underneath all of it was social tolerance. Caring for an injured group member consumed calories, attention, and energy. And in a small prehistoric community, none of those resources were unlimited. Feeding someone who couldn't currently hunt meant everyone else accepted a slightly smaller share. Protecting them could slow the whole group down. Staying nearby might even expose everyone to added danger. And yet, healed injuries show ancient people sometimes made exactly that choice anyway. This wasn't necessarily charity in the modern sense either. An injured hunter might eventually recover. An older person who could no longer chase game could still remember water sources, migration routes, tool-making techniques, or which specific mushroom turned dinner into a genuinely bad decision. Knowledge carried real survival value, and human communities had started storing that knowledge inside actual people. So the first hospital wasn't a building. It was a social agreement made around a fire. You can't help us survive today, but we'll help you survive anyway. Long before humans had anything resembling a medicine cabinet, they had something almost as useful: the ability to watch what happened after trying something questionable. Prehistoric healing probably began through repeated accidents, rather than one brilliant discovery. Someone pressed a hand against a bleeding cut and noticed the pressure slowed it down. Someone rested an injured leg against a branch and found that keeping it still hurt less. Someone smeared mud or clay over a wound, maybe just for cooling or basic protection, and occasionally survived long enough for the group to actually remember what happened. This wasn't science in any modern sense. There were no controlled trials, no written records, no warning labels, just observation, memory, and an alarming number of volunteers who hadn't exactly volunteered. Animal behavior may have offered additional clues. Chimpanzees and several other species have been directly observed swallowing rough leaves, chewing bitter plants, or applying biological material when sick or wounded. Ancient humans were sharp, practiced observers of animal behavior, since their own survival depended on predicting where animals moved, what they ate, and what they instinctively avoided. Watching an injured animal chew a particular plant wouldn't automatically reveal a working medicine, but it could plausibly inspire experimentation. Then came genuine trial and error. Bitter bark reduced pain. A certain leaf seemed to calm swelling. Clay absorbed moisture and hardened into a rough shell around an injured limb. Plant fiber could bind a wooden splint firmly in place. Cool water rinsed away visible dirt, while sitting near the fire helped an injured person avoid hypothermia. None of it required any understanding of cells, microbes, or inflammation. It only required recognizing that one action produced a noticeably better outcome than another. If a detail like that already has you rethinking what primitive medicine actually means, stick around, because the physical evidence gets considerably more remarkable from here, and if you're enjoying this kind of deep dive, go ahead and subscribe now. Of course, prehistoric experimentation came with a genuinely brutal peer review process. A useful plant might ease pain. A similar looking plant might cause vomiting, hallucinations, or a very educational funeral. Knowledge therefore had to be carefully remembered and passed along. Which bark could be safely chewed? Which leaves actually belonged on a wound? Over generations, isolated discoveries could calcify into genuine tradition, and the people who remembered which plants worked, how to prepare a binding, or how to reset a displaced limb became genuinely valuable to the group. A real chemical thread runs through some of this too. Willow bark, one of the more consistently cited pain remedies across ancient and traditional cultures, contains a natural compound called salicin, which the human body converts into a substance chemically related to modern aspirin, a rare case where folk remedy and modern pharmacology actually land on the exact same molecule from two completely different directions. One arrived at through generations of careful trial and error, the other through a modern laboratory bench roughly 100 years ago. Bones themselves are terrible storytellers in most respects. They offer no dialogue, no eyewitnesses, and absolutely no interest in dramatic pacing. But when a bone is injured and the person survives, it starts quietly recording the recovery. A fracture that occurred right around the time of death typically keeps sharp, unfinished edges. A fracture that healed during life develops new bone growth around the break. And the longer the person survived afterward, the more extensive that remodeling becomes. It functions almost like a built-in timestamp, one that essentially reads, "This was catastrophic, and somehow I kept going anyway." Few individuals demonstrate this better than Shanidar I, a Neanderthal discovered in Shanidar Cave in present-day Iraqi Kurdistan. He survived crushing trauma around his left eye, likely losing much of his vision on that side. His right forearm and hand were missing entirely. One leg showed clear impairment, and abnormalities in his ear canals may have caused substantial hearing loss. Yet he lived into genuinely older adulthood for the time. Paleoanthropologist Eric Trinkaus, who has spent decades studying the Shanidar remains in detail, has argued this combination of injuries points strongly toward sustained assistance from others, since a person with reduced vision, reduced hearing, limited mobility, and only one functional hand would have struggled enormously to hunt, escape danger, or manage daily tasks entirely alone. It's worth being fair to the ongoing debate here, though. Other researchers, including archaeologist Penny Spikins, have pushed back somewhat on how far this evidence can responsibly stretch, cautioning that Neanderthals may have been more physically capable despite serious injury than some popular retellings suggest, and that compassionate care shouldn't be assumed automatically every time a healed injury shows up in the fossil record. Shanidar I's survival still strongly suggests real social support of some kind. It just may not prove every single specific detail people like to imagine about exactly how that support looked in practice, day to day. There's also a striking case from Liang Tibo Cave in Borneo, dating back at least 31,000 years, identified and published by researcher Tim Maloney and colleagues. The lower portion of this individual's left leg was missing, and the surrounding bone changes led the research team to interpret it as evidence of deliberate surgical amputation performed during childhood. Even more remarkably, this particular individual appears to have gone on to survive another 6 to 9 years afterward, based on the estimated age at death. Removing a limb without modern equipment means controlling catastrophic bleeding, avoiding fatal shock, and somehow preventing infection in a tropical environment where microbes were presumably working overtime the entire time. There's genuine scientific debate over how confidently trauma can be ruled out as an alternative explanation for the missing limb, but the surgical interpretation, if accurate, suggests real anatomical knowledge, including a working understanding of where to cut and how to manage the wound afterward, existed considerably earlier than most researchers had previously assumed. It's also worth noting this find pushed the earliest confirmed evidence of successful limb amputation back by roughly 24,000 years compared to the next oldest known case, a genuinely dramatic revision to the accepted timeline of human medical capability rather than a minor, easily forgettable footnote in the literature. Prehistoric skulls provide another unsettling clue: trepanation, the deliberate scraping, cutting, or drilling of an opening into the skull. On a striking number of recovered examples, the edges show clear healing, proving the procedure was performed on living people who genuinely survived it afterward, sometimes for years. French physician and anthropologist Paul Broca was among the first researchers, back in the 1870s, to recognize that certain ancient skulls showed real bone healing around these openings rather than simple postmortem damage, effectively identifying prehistoric surgical survival for the first time within the modern scientific record. Broca's original observation launched an entire subfield of research that continues today, with archaeologists having since documented trepanned skulls on nearly every inhabited continent, spanning cultures with no plausible contact with one another, evidence that the underlying idea itself, however it happened to be originally justified in each specific place, was independently arrived at again and again, completely separately, across the full sweep of human history. Why trepanation was performed at all remains genuinely uncertain. It may have treated head trauma, chronic pain, seizures, or purely spiritual concerns, quite possibly some combination of all four at once. The bones can't tell us the healer's name or exact technique, but they reveal something almost as important: the patient lived. For all the remarkable physical evidence, the most honest answer to many specific questions about prehistoric medicine is still a genuinely careful, we're not entirely sure, and that uncertainty is actually part of the real story. Take medicinal plants as an example. It's tempting to picture a confident prehistoric healer handing out herbal remedies with the calm bedside manner of an experienced family doctor. The reality was almost certainly messier. Researcher Karen Hardy and colleagues analyzed fossilized dental plaque recovered from Neanderthal remains at El Cedrón in Spain and identified chemical traces of chamomile and yarrow, both plants offering little nutritional value on their own, but both long associated with medicinal use in later human cultures. Did Neanderthals eat them specifically because they eased discomfort? Simply because they were available? Or because someone genuinely liked the taste after several rough days without proper food? The physical evidence, however carefully analyzed, rarely settles that specific question of intent definitively one way or the other. The same basic uncertainty surrounds infection control. Modern medicine understands that invisible microorganisms cause disease. Prehistoric humans clearly did not. Yet they may have stumbled onto genuinely practical ways to reduce infection simply by observing outcomes. Washing wounds with clean water, removing dead tissue, covering injuries with fresh plant material, or keeping an injured person away from contaminated waste could all meaningfully improve survival odds without anyone ever understanding exactly why it worked. Experience, in medicine especially, routinely arrives generations, sometimes millennia, before the actual scientific explanation ever catches up to it. Then there are the shamans. Nearly every traditional society ever recorded in history includes individuals who combined healing, ritual, and spiritual leadership into a single role. Archaeologists suspect similar figures may have existed deep into prehistory, but skeletons simply can't identify a person's profession directly. A burial can't label someone the village doctor. At best, unusual grave goods, an unusually diverse plant residue signature, or repeated evidence of specialized practice performed on multiple different individuals allow for cautious, appropriately hedged interpretation rather than any confident identification. Which brings the trepanation question back around. Since some researchers argue it relieved pressure after traumatic head injuries, others suggest treatment for chronic pain or neurological disorders, And another entirely plausible explanation is symbolic, the belief that opening the skull released harmful spirits responsible for illness. These explanations aren't actually mutually exclusive. A healer might have genuinely believed evil spirits caused headaches while accidentally, and quite beneficially, relieving dangerous intracranial pressure after a real head injury at the exact same time. Good outcomes have never strictly required correct underlying theories, a pattern that shows up again and again throughout the history of medicine, long after prehistory ended, right up through the past few centuries. Perhaps the biggest ongoing debate concerns compassion itself. Were injured people cared for out of empathy, family loyalty, mutual obligation, or plain practical self interest? Evolutionary biologists continue arguing over exactly where altruism ends and calculated survival strategy begins. Helping an injured hunter today might mean that same hunter helps you survive a hard winter later. Caring for aging grandparents preserved decades worth of accumulated ecological knowledge that quite literally nobody else in the entire group possessed. Knowledge that couldn't simply be looked up or rediscovered on short notice if it was ever allowed to disappear. Cooperation and compassion likely never developed as entirely separate evolutionary forces. They probably evolved together, each one reinforcing the other. Prehistoric healing, in other words, was never purely about fixing broken bodies. It was about building communities where survival itself became something genuinely shared. Once a specific treatment worked more than once, it stopped looking like luck and started looking like knowledge. And that shift likely transformed prehistoric healing from an improvised emergency response into a recognized, ongoing social role. In small communities, the person who remembered how to bind a fracture, prepare a useful plant, or clean damaged tissue properly became genuinely indispensable. Their experience could be taught, repeated, and refined over time. Medicine didn't need textbooks yet. It needed memory, ideally attached to a healer who reliably avoided confusing the pain-relieving route with the one that made everyone see glowing animals that weren't actually there. Over generations, practical treatment likely grew tightly intertwined with ritual. Illness and injury were frightening, partly because their real causes stayed invisible. A wound could look manageable, and then suddenly swell, darken, and kill someone days later for no apparent reason. Without germ theory or basic neurology, supernatural explanations weren't irrational given the knowledge actually available at the time. They were honest attempts to give chaos some kind of cause. The healer may have doubled as a ritual specialist, as a direct result, blending wound cleaning, plant application, chanting, smoke, touch, and symbolic objects into a single unified act of care rather than two separate categories the way modern observers often try to divide them. That psychological dimension mattered in very real, practical terms. An injured person who genuinely believed the group hadn't abandoned them was measurably more likely to stay fed, protected, and calm, and ritual gathered people directly around the patient, turning private suffering into a shared responsibility. Even when the supernatural explanation happened to be wrong, the social response built around it could still meaningfully improve someone's odds of survival. As communities expanded during the Neolithic period, healing knowledge became even more important still. Farming increased population density, repetitive physical labor, interpersonal conflict, and direct exposure to infectious disease all at once. Permanent settlements also let specialists accumulate real, focused experience instead of constantly relocating between temporary camps. Certain individuals likely became specifically known for treating wounds, assisting difficult childbirths, managing fractures, or performing procedures like trepanation. Healing could also translate directly into social authority. A person believed genuinely capable of restoring health held more than technical skill alone. They controlled rare knowledge, interpreted misfortune for the group, and often stood between the community and forces nobody else fully understood. Medicine, religion, and leadership began growing outward from essentially the same shared root system at the exact same moment in human history, entangled in ways that would remain deeply intertwined for thousands of years afterward. Today, surviving a serious injury can involve trauma surgeons, blood banks, antibiotics, imaging equipment, rehabilitation specialists, and a billing department seemingly determined to injure you all over again emotionally. The technology is genuinely new. The basic underlying strategy is ancient. A modern hospital is, at its structural core, a highly organized version of the prehistoric campfire. It keeps vulnerable people warm, protected, fed, monitored, and surrounded by specialists, while their bodies attempt the slow biological work of actual repair. The machines involved are considerably more impressive today. The overhead lighting is noticeably worse for everyone's complexion, but the underlying organizing principle genuinely hasn't changed at all across tens of thousands of years. When one person can no longer survive entirely on their own, the group temporarily carries them. That may be one of the more important things archaeology reveals about our own species. Human evolution often gets told as a parade of weapons, tools, and increasingly clever ways to chase down dinner, sharp stones, spears, fire, bigger brains. But a species doesn't thrive through aggression and cleverness alone. It also thrives by preserving injured hunters, aging knowledge keepers, disabled family members, and children who need years of sustained support before becoming remotely useful themselves. Care itself became a genuine survival technology. The person with the healed fracture wasn't simply lucky. Their survival represents stored food, shared labor, remembered plants, guarded sleep, and repeated decisions made by other people to stay close by rather than move on. Every single healed ancient bone recovered from the archaeological record is genuine evidence of two entirely separate biological processes unfolding at once. The body quietly, mechanically repairing itself over time, and the surrounding community actively, deliberately refusing to simply let that particular body disappear before it had the chance. Prehistoric medicine was obviously limited in real, measurable ways. Many injuries still caused unbearable pain, permanent disability, or outright death. Treatments could fail outright. Genuinely useful remedies could sit right alongside actively harmful superstition. Survival was never, under any circumstances, remotely guaranteed for anyone facing serious injury back then. But thanks to that basic willingness to stay and help, it was no longer flatly, automatically impossible either. The greatest medical breakthrough may not have been the first splint, the first herbal paste, or the first hole carefully cut into a skull. It may have simply been the moment humans understood, however instinctively and however long before they could explain why, that another person's suffering was a problem genuinely worth solving. That same basic decision, made silently by countless people across tens of thousands of years, still echoes every single time someone calls an ambulance, donates blood, sits patiently beside a hospital bed, or simply helps a total stranger stand back up off the ground. So, how did ancient humans actually survive serious injuries 50,000 years ago with no ambulance, no antiseptic, and no antibiotics whatsoever? Not primarily through anything resembling medicine, as we'd recognize it today, but through actual people who were genuinely willing to stay close by. Fire, shelter, food sharing, and hard-won trial and error treatment all played genuine, measurable roles in that survival, but underneath every single one of those elements sat the exact same basic decision, repeated by countless different individuals across tens of thousands of years. Someone, somewhere, chose not to leave. A broken leg could absolutely, genuinely end a person's life back then, and often did. It very often didn't, though, because somebody, again and again, across an almost unimaginable stretch of time, made the deliberate decision to stay behind and personally make sure that it wouldn't.